Cannabis use and psychosis. Cannabis is linked to many different types of psychosis. I have chosen to narrow my focus onto cannabis-induced psychosis. What is cannabis-induced psychosis? Cannabis-induced psychosis, also known as CIP, is a mental health condition that is triggered by the use of cannabis. Typically, cases are acute, meaning that it begins with the consumption of cannabis, and the episode stops once cannabis has left the system of an individual. In more severe cases, episodes can last substantially longer, lasting up to 2 weeks after cannabis has left the system of an individual. Risk and age factors. Genetic predisposition plays an important role in one's pre-exposure to cannabis-induced psychosis. People with family history of psychotic disorders are at higher risk of developing CIP. The earlier a person begins consuming cannabis, the higher risk of them developing cannabis-induced psychosis. This is especially the case in adolescent individuals, as their brain is still developing. Environmental factors also play a role in developing cannabis-induced psychosis. Those who have had stressful life events and trauma are more susceptible to develop cannabis-induced psychosis. Symptoms. Symptoms of cannabis-induced psychosis include delusions. The most common delusion associated with cannabis-induced psychosis is paranoia, and this commonly leads to the suspicion of others. Hallucinations are also a common symptom of cannabis-induced psychosis. These hallucinations can be visual, such as seeing things that are not truly there, auditory, meaning hearing voices or movement that is not real, and can even impact and cause hallucinations in sense of touch and smell. People who suffer from cannabis-induced psychosis often experience disassociation, meaning that they feel as if they're outside of their body. Derealization may also occur in an individual suffering from cannabis-induced psychosis. Derealization meaning feeling as if they or others are not real, or as if they're in simulation of things of a sorts. And disorganized thoughts are another symptom of cannabis-induced psychosis. Individuals with cannabis-induced psychosis often report disordered and chaotic thoughts when they're in an episode. It's also not uncommon for individuals suffering from an episode to struggle to stay focused. The diagnosing process. The process of getting diagnosed with cannabis-induced psychosis is more difficult than one would believe. This is because cannabis-induced psychosis is a rare disorder with less than 0.5% of reported cannabis users being diagnosed. This means all other causes of psychosis, like schizophrenia, bipolar disorder, BPD, must be ruled out before diagnosis of CIP can even be considered. When getting diagnosed with cannabis-induced psychosis, a clinical assessment is done, assessing all symptoms. It is also required to review a detailed medical history. This will see if you're pre-exposed to cannabis-induced psychosis, schizophrenia, bipolar disorder, BPD, other disorders where the form of psychosis could be stemming from. And also, cannabis use history will be reviewed, because again, cannabis-induced psychosis, if the individual has never consumed cannabis, the episode's not coming from cannabis, it's coming from one of those other disorders, psychotic disorders. Upon the clinical assessment, symptoms are monitored by a doctor once the patient stops consuming cannabis, and if symptoms reduce, this supports the diagnosis of cannabis-induced psychosis. Again, because if these episodes are going away after the person stops consuming cannabis, yes, it could be coincidental, but more than likely, cannabis-induced psychosis could be a causation. So this is a recap video to hopefully clear up any misunderstandings or unclarities I have in the previous slides.
Dr. Troutman, what is weed psychosis?
Weed psychosis is a real thing. So this is fascinating. So weed psychosis is a thing that happens with heavy users, sometimes with not even heavy users, that develop psychosis that look like schizophrenia after ingesting THC. When I see in the inpatient hospital weed psychosis, it's usually someone who's pretty young, never had a psychotic disorder before, and they come in, their family brings them in, and they're hearing voices, they're paranoid, they're delusional, they're not able to keep themselves safe. And this persists after the THC wears off from their bloodstream. So it could be weeks and weeks of someone presenting as if they have schizophrenia. And we talk with the family, and it's always a waiting game. We treat them with the medications used to alleviate schizophrenia, and we wait. And the family hopes that it's weed psychosis because that's a better outcome than schizophrenia, because weed psychosis will resolve. But weed psychosis is a thing. It's a risk for you to know about if you ingest.
So yeah, hopefully that video clears up anything that I left unclear.
Dr. Troutman,
why can cannabis use lead to psychosis? It is believed that the primary cause of cannabis-induced psychosis stems from tetrahydrocannabinol, more commonly known as THC. This is believed because THC is the psychoactive compound responsible for the feeling of intoxication in cannabis. THC disrupts the brain's normal function and affects dopamine levels. High-potency cannabis makes individuals more prone to this disorder. This is due to it containing higher levels of THC, the compound, once again, responsible for the onset of cannabis-induced psychosis. Frequent use of cannabis also increases the risk of developing cannabis-induced psychosis. This is because the continuous exposure to THC can change the brain chemistry over time. This makes individuals more susceptible to develop cannabis-induced psychosis. The neuroanatomy of cannabis-induced psychosis. THC binds to the cannabinoid receptor, CB1, which controls the release of neurotransmitters, glutamate and GABA. CB1 is found in the central nervous system and helps regulate memory and emotions. This results in a disruption to the endocannabinoid system. This can cause abnormal release of dopamine. The dysregulation of dopamine helps explain the symptoms of delusions and hallucinations. This is because increased synthesis of dopamine results in an overreactive dopaminergic system, meaning the dopaminergic system wants something to fire at, so that's where you get these delusions and hallucinations from. This is a video on how cannabis affects the endocannabinoid system.
cannabis opened the window into the functioning of our body. completely unexpected window because what was discovered was that THC binds to receptors in the brain and outside the brain. And when it does so, when it binds to these receptors, the cells now behave differently.
Cannabinoid receptors, named after cannabis, are found on nearly every organ in the body. They bind with our own cannabis-like molecules called endocannabinoids, which regulate functions like sleep, cognition, memory, and mood. Unlike other brain chemicals, they travel backwards across the synapse, where they control the release of most neurotransmitters.
So yeah, that is how cannabis reacts with the endocannabinoid system. The endocannabinoid system modulates GABA release. When CB1 receptors are activated by THC, this reduces the release of GABA. This leads to a disruption to gamma waves. This helps explain the symptoms of disorganized thoughts, as when gamma waves are disrupted, this can cause impairments to memory and reduced attention. This also is similar to other psychotic disorders, such as schizophrenia and bipolar disorder, BPD, because those disorders also have disrupted gamma waves. It has been seen in cannabis-induced psychosis that it leads to an overreaction in the right hemisphere of the brain, but also abnormal activation in the left temporal and parietal areas. So here you see the left hemisphere, it's low in that activation, and you see the darker spots in the left temporal parietal areas. And then looking at the right hemisphere, you see that neutral activation, but you see those darker spots with higher activation. Again, posterior angle, a lot more neutral, but also a lot more dark in the right hemisphere. Yeah. How to treat cannabis-induced psychosis. Treatments for cannabis-induced psychosis include medications. For a short-term fix, antipsychotic medications can be prescribed, as said in the recap video. This is because this will reduce the symptoms of hallucinations and delusions. But again, as all medications, they have side effects. So the shorter you can be on them, the better. And a patient should not consume cannabis while on antipsychotic medication for cannabis-induced psychosis. Just because you have an aid to help fight off symptoms does not mean you should induce them on yourself. It's counterproductive. Psychotherapy is also very beneficial to individuals suffering from cannabis-induced psychosis. It allows them to have an understanding of their symptoms and how they feel. It can also help them manage their symptoms, so if they end up in an episode, they have resources to help them. This also can help identify underlying issues, such as anxiety and substance use disorders. So psychotherapy is very helpful in treating cannabis-induced psychosis. Lifestyle changes are the most obvious treatment. Stop consuming cannabis, and your episodes will reduce and go away completely if you don't consume cannabis. But healthier diet, regular physical activity, proper sleep, those will also help you feel better and recover from your episodes of cannabis cannabis-induced psychosis. And if substance abuse treatment, if the individual suffers from a dependency or an addiction to cannabis, um, there are many facilities and groups that are more than willing to help the person overcome the addiction to the substance and help them, again, relieve their symptoms because it is induced by cannabis. And if you don't consume cannabis, you won't experience episodes of cannabis-induced psychosis. The prognosis for cannabis-induced psychosis. The prognosis for cannabis-induced psychosis is generally very promising, especially if it is caught early. Most people will make a full recovery with the help from the appropriate treatments. Again, these treatments it's like a puzzle. They're all pieces to the puzzle to help an individual recover from cannabis-induced psychosis. Yes, they may individually help the individual, but using them all together will help the individual strive and get better. So, in summary, cannabis-induced psychosis is a rare mental health condition that is triggered by the use of cannabis, with episodes that can last up to 2 weeks in length. Symptoms of cannabis-induced psychosis are delusions, hallucinations, disassociation, and disorganized thoughts. This condition is caused by THC disrupting the brain's normal function. Cannabis binds to the CB1 receptor, which controls release of glutamate and GABA. This causes a disruption to gamma waves, similarly seen in schizophrenia and bipolar disorder. And treatments for cannabis-induced psychosis include antipsychotic medications, therapies, lifestyle changes, and substance abuse treatment. And cannabis-induced psychosis is very likely to be helped and controlled and no longer affect an individual if caught early and treated appropriately. So that concludes my presentation, and thank you guys for watching.